Let's go to Tom in Connecticut. Tom, welcome.
Hi, Laura. In general, I believe that the best answer here is not to get rid of insurance companies. I think they're going to be an extremely important part of the kind of administration of any plan. My thinking is that the country does need some sort of a universal coverage, and that it's inevitable to a certain extent. And I also like the idea of funding it with a VAT tax, which I think operates on a couple different levels in terms of
more taxes,
some of the benefits.
More taxes and a lurch towards socialism, because this is what Europe has. And we see what's happened with Canada, and we see what's the big piece that just came out about the challenges in the Canadian healthcare system. They pay a high price for free healthcare. A piece that just came out in Investors Business Daily. So Bernie Sanders is selling snake oil. Government-run healthcare. I have two words: VA, Veterans Administration. Go to the VA for treatment. My dad didn't want to go to the VA for treatment. And we had the best system in the world, and we screwed it up. And we certainly can't have 20 million people getting free health care in the United States, which is why we have to police our borders. Imagine the money we would save just for that alone. $17 billion a year for illegal immigrant health care for those in ICE custody. Just that. And they're all upset that illegal immigrants are being kept in tents. Before it was they were kept in cages. Now they're all together in a tent, and that's not good enough either. By the way, that was a big story this week. CNN exclusive. We have pictures of migrants in large outdoor tents. Well, where do you propose we put them? You won't give the administration money for detention facilities. You won't allow us to separate children from people who are adults and perhaps not even related to them. You won't allow that. And you won't allow that for 3 weeks in order to determine if these kids are actually related to the families and process them out of the country if necessary. So they won't allow. All they do is complain. They have no solutions for our border. And that just adds to the cost of all this health care. And we health care, schooling. We don't need this extra burden on the country. I mean, these Central American countries have got to fix themselves. We can help maybe on the margins, but we have to take a tough line on this. By the way, Bill de Blasio. This is from a few months back. He is one of the Democrats who at least is honest about how he wants to spend your money.
If you're undocumented, and that's several 100,000 New Yorkers who are our neighbors, who contribute to our economy, they're undocumented. If they don't get health care, if they get sick, everyone gets sick. If the whole community isn't healthy, then we all suffer. So we're saying to them, we're going to give you a health care card. You're going to get a primary care doctor. When you need help, you get help. When your kids need help, you get help for them. And the whole community gets health care. I don't want someone who is part of the backbone of our economy, and that's the blunt reality in this country. Undocumented immigrants are part of our economy. I don't want them going to work sick and getting everyone else sick. I don't want their kids suffering. I want to make sure everyone's healthy.
What a buffoon. I mean, the man is just a complete and total embarrassment. By the way, what is old Bill de Blasio going to do in the next 10 years when 50% of those jobs are performed by robotics and with artificial intelligence changing the way people work? What is he going to do with them then? Everyone just continues to get free stuff? Who's paying for it? Absolutely crazy. He rolled out his health care plan for illegal immigrants about the health care card. It's called Care Card. What do you have, like 5 people at his event where he rolled this out? It's just... But I mean, again, at least he's being honest, saying, look, I want to give all this free stuff out. So, okay, well, if you want to vote for more free stuff for illegals because they don't get enough free stuff now, then go ahead and vote for it. If you like the streets of New York, vote de Blasio. If you love the filth on the streets of New York today, vote de Blasio.
Today is a big moment because today is about making a change. Today, I am so excited to announce the next big step in our plan to guarantee health care for all New Yorkers. Guarantee. This card gets you and your family what you need. I want to emphasize, health care is a human right. Everyone should have the right to quality, affordable health care. That needs to be the way we move forward.
Why does he think doctors are retiring? Why do these guys think doctors aren't, you're not graduating the doctors you used to? They're not making any money. Why do you think OBGYNs are going into plastic surgery? Because it's fee for service. Not getting any reimbursements. It's not dealing with insurance companies. You're not dealing because fee for service. You're turning doctors into they're like widgets today in a system that doesn't even compensate them adequately. But the insurance company stocks are way up, way up, because they figured out how to game the whole system. We have a lot more to get to here on the Laura Ingraham podcast. Delighted you're with us. Remember to tune into the Ingraham Angle every night and go to lauraingraham.com for updates on our broadcasts and things that we think you really need to keep your eye on. So make sure to do that as well. Follow me on Twitter and Facebook if you want to be part of the show. Ingraham.podcast@gmail.com. Ingraham.podcast@gmail.com. Steven Camarota is the Director of Research for the Center for Immigration Studies. The healthcare costs just for illegal immigrants arriving this year, just the ones who've come here this year, is staggering. I saw it firsthand with a border crosser at the Rio Grande last week who, they're all in bare feet and they jump in the river and then they're picked up by the boats. Sometimes the Border Patrol jumps in to get them. That's what we do. We're not going to let anyone drown. So we pick them up. They're bare feet. Then they slip. They fall. And then you got to call the medic in. And then they're coughing. A lot of them were coughing when they arrived. And I feel terrible for them, especially for the children. The children are the ones that I feel the worst for. But you can see the condition they arrive in, and a lot of it is not good. Well, you're paying for it. Steve joins us now. Steven, good to talk to you, my friend. How are you?
Good to be with you.
So how much is this costing us for health care for illegal immigrants on an annual basis? How do we know these facts?
Well, we have some idea by looking at the government surveys that they collect. In terms of health care, one of the biggest areas where illegal immigrants impact is the huge fraction who are uninsured. So more than half of illegal immigrants, say maybe 6 million, have no health insurance. And then there's a lot of illegal immigrants who are on Medicaid when they get pregnant, when they have children. So we've previously estimated that we're paying for about 200,000 births a year, or about two-thirds of births, of all births to illegal immigrants, are paid for by Medicaid. And so you're looking at somewhere around $3 billion a year just to pay for births to illegal immigrants in the United States. The total cost, when you talk about all those uninsured people plus the people on Medicaid, obviously, that's several times that. So it might equal $10 billion a year to provide health care. Now, it's important to note that illegal immigrants are mostly healthy people. They are mostly young people. That's why they're mostly healthy. There are communicable disease issues. There are vaccination issues and so forth. But overall, they are not a particularly sick population, but they're an incredibly poor population. And that gets to the big question. The reason they're poor is because they're overwhelmingly people who don't have a lot of education. People who don't have a lot of education, just like their native-born counterparts, don't make much money. And so the poverty rate for Central Americans is several times higher than it is for the native-born, and their welfare use rates tend to be high, and so forth. They often receive benefits on behalf of their children. It's not that they don't work. It's not that they all came to get welfare. That's not what's happening, is that they tend to have jobs and earned income that reflect their education. And in the modern American economy, such people tend to have very low incomes, tend to pay very little in taxes, and use a lot in services.
Well, I spoke with a number of new border crossers last week, and there are dozens and dozens and dozens that were in the Del Rio sector. And so just as they came over and as they were being processed in the processing center, I had a chance to talk to a lot of them. My Spanish is pretty good, so was able to understand most of what they were saying. And then I had an interpreter for the people who spoke too fast, and I couldn't understand them. But a lot of them just said to me that, well, they have family here, and I said, well, how did you afford the journey? And a lot of them said, no, we didn't pay anything. They wired money, or are wiring more to the bus depot where they're going to end up because Border Patrol drops them in a central location. So they've already had money wired from individuals living here, friends and family, and many of them are here illegally. So we're sitting here going, okay, the illegal immigrant population is managing to fund a new illegal immigrant population by wiring money back home. Then it's ultimately given to cartels to get their safe passage. Not just the cartels, but they're paid. And that's in and of itself, I think, is a shock to most people, Steve.
Well, here's the thing to remember. That's always been true. The new part is that we help them, right? That we release them at the border. Mm-hmm. And I think your listeners just need one brief bit of background. The reason that happens is not because we're all crazy here or that they are gaming the system, but the reason it's happening is we have two fundamental problems. One is when a person is not from Mexico, Mexico won't take them back. So you can berate Mexico all we want, but why would they take them back? They have no reason to. They're not their citizens. Now, you're right. They let them through their country, but they were headed to the United States, and they figured, well, better get off our hands. The second issue that you have to think about is that when a child is present, we don't have a good way of an institution holding children under any circumstances. It's why we don't have orphanages anymore, right? Mm. We found that there was constant abuse, and even with all the problems with foster care, we found that was better. So when you couple those two problems, a person's not from Mexico, and we can't hold children in institutional settings. Now, we do have other procedures that create even more problems.
Yeah, we have a judge saying you can't be held to 21 days. Every Border Patrol agent I talked to said we have no room. And
now, on top of that, what do you do when a person applies for asylum? Well, I mean, you have to hear that case. You can use asylum officers to very quickly assess credible fear, but the credible fear criteria we're using is so in favor of the illegal immigrant that everybody's using it knowing that the system is overwhelmed. They'll be released with a long day. The presence of children complicates it. The unwillingness of Mexico to take people back. So what are the changes? You need to be able to hold more people. You need more asylum officers and a fundamentally different way of evaluating credible fear so that you can quickly and radically fly people back in very large numbers and no one will come then.
So here's what I routinely hear from our friends in the administration that will go unnamed. Groups like the Center for Immigration Studies they're good at stating the problem, but we need legislation to change the basic issue, which is you can't return people to Central American countries. You cannot immediately deport them. They have to have hearings. That law has to be changed. And it also has to be changed Agreed. That we can't keep kids longer than 21 days. We need facilities. So we need Democrats for those votes. Democrats today are not going to agree to that, even though they did years ago. So how do you do it? So you have to reform the whole system. And they point to groups like yours as part of the problem.
Yeah, here's the thing that the administration's doing that's so problematic. They're focusing all on reforming the legal immigration system, which I'm all in favor of. Okay, what President Trump should be doing is berating the Democrats every single day. They don't want to control the border by reforming asylum, and they don't want to control the border by increasing detention space and changing certain policies. Yes, it's true we need a change in legislation. Even if we don't get it, at least he can secure a political victory by browbeating the Democrats, saying, you want these people in charge? Look what they're doing. They're creating a de facto situation in which the border is open, because the reality is if this doesn't change, it's only going to get worse, because it's not just Central Americans. The word is out. You show up at the border and you're not from Mexico and you apply for asylum, or you have a child and you are in scot-free. And there are many millions of people who are willing to trek through Mexico or be smuggled into Mexico so that they can do that if you don't change the law. And the reality is the administration should be focused like a laser beam on browbeating the Democrats on that. It's a great issue. The Democrats want open borders because they don't want these reforms.
So your argument would be
that's what they should be doing.
So your plan would be the president should talk about it more.
A whole lot more. In terms of what to do.
That's not going to move a single Democrat vote. But Steve, I mean, I love you. You know I do. That's not going to change a single Democrat vote. That's not really a plan. That's advocacy. I love advocacy. I do it every night, but that's not a plan. And I don't want any of this stuff. I don't want more legal immigration because I think we have plenty of people with automation coming and everything else.
Agreed.
I want wages to stay high. I'm not for that at all, but it seems like it's difficult to see the structural changes that are going to be brought to bear unless the Republicans get some Democrats to support this. At some point, I just don't see they're ever going to support this.
Look, the reality is this is going to go on for some time because even if whatever policy you and I may propose, all right, look, let's start holding people more. Let's create some tent cities. There's going to be a federal judge to rule against it as well. And so unless we have legislation, and even then there might be a federal judge because changes in asylum law might still be overruled by a federal judge. I mean, that's the reality too. This is an enormous national crisis at the border, and we should be focusing and constantly talking about it. It has enormous implications, as you said, for the education system, for the healthcare system, for the low-wage labor
it's
market,
a winner
all
issue.
of these things.
Yeah,
so
it's a
I
winner.
agree. But there is no sort of fix right now because we need legislation and we have the other impediment of federal judges.
Mm-hmm.
Maybe what you need is a political negotiation. Give the Democrats something they want, some kind of legalization for some fraction of DACA recipients, and then maybe they'll change the asylum law. Maybe. That kind of thing. That kind of possibility maybe exists. But this is not going away, and it will continue to get worse because, as I say, word is out. There isn't any obvious way to hold children because the federal courts will not allow us to hold children. And we won't be able to separate the children from the parents, which is an effective tool to deter more people from coming, but we won't be able to do that either. So that's the reality. When you're a nation of laws with an overbearing judiciary and a divided government, it's almost impossible to solve a problem like this. I mean, I don't have any good news for you. I mean, that's my take on it.
Steven Camarota, thank you so much for joining us, Director of Research, Center for